So what is indigestion? Indigestion is a term that is used to describe a whole range of symptoms such as excessive burping, it's like you're constantly burping all the time, heartburn, that's when you feel that burning sensation in your upper chest and it sometimes goes up towards your throat. Feeling full easily after meals or feeling bloated, nausea, that's symptoms of feeling sick, you might again feel like food is coming up towards your mouth. You also might get an excessive saliva in your mouth or you might get an acidic taste in your mouth as well. Now there are several causes for indigestion such as smoking, drinking too much alcohol, fizzy drinks, coffee, chocolate, eating certain types of foods which might be fatty, spicy or acidic foods. Even stress can cause indigestion. Eating very heavy meals or too much food, eating late at night, wearing your clothes too tight can also bring about indigestion. Bad bacteria in the gut such as Helicobacter pylori can cause an infection which can bring about symptoms of indigestion. And also if you're on several medications such as Aspirin, Ibuprofen, or you take oral steroids such as prednisolone can also trigger indigestion. So when should you be concerned that this might not be simple indigestion? Well, if your symptoms do not go away despite taking medication or changing your lifestyle, then you might have to think, I need further investigation. So for example, look out for symptoms such as difficulty swallowing, which might get progressively worse over time. You might have loss of appetite, weight loss, vomiting, feeling full all the time, or you just have that persistent bloating. Having stomach or upper abdominal pain is not really common with indigestion, so if you notice that you're having stomach pain all the time, which can happen with or without meals, or you're having stomach pain at night time, or sometimes your stomach pain might radiate to the back, then really you should be seeing a doctor. And the question is, what could this be? Well, you might think, could this be a stomach ulcer? Could this be a bacterial infection? Or could this be cancer? So if we assume this is simple indigestion, what kind of treatment can you have? Well, you can try over-the-counter treatment such as Gaviscon Advanced. This is an antacid, which helps to act as a barrier above the stomach, so it prevents food from coming up and helps to neutralize excessive acid. It's usually fast-acting and works within 4 hours and can be taken after every meal or at bedtime. Other over-the-counter medications you can consider include Reni, Pepto-Bismol, and Zantac, also known as ranitidine. There is another type of medication called a proton pump inhibitor, also known as omeprazole, and you can get this as Losec or Nexium as a 20mg or 10mg tablet for the latter. What these medications do is they help to reduce the production of excessive stomach acid and they provide relief within 24 hours of taking the medication. However, to get maximum effect with the medication, this might take a few days to kick in and you usually have to take it for at least 2 weeks to a month. In some cases, if you find that your symptoms are quite severe, you can actually double the dose of the omeprazole. For example, you can take 20mg twice a day, morning and evening. Do this for a month. And then maybe in the second month, if your symptoms still persist, you can reduce that to 20mg to be taken once a day. However, you need to be aware of taking omeprazole long term, as this can cause vitamin B12 deficiency and can also reduce your bone density, known as osteoporosis. You can also check out my video on the side effects of long-term omeprazole. Ideally with medications, we advise to try and avoid long-term use. So you might think of your lifestyle measures such as trying to reduce weight by exercising and by changing your diet, so reducing fatty foods for example. Also try and avoid acidic or spicy foods that can trigger indigestion. Stop smoking. Stop drinking excessive alcohol. You might need to cut down on your coffee and your chocolate. Try and avoid eating late at night. Try and avoid eating quite heavy meals. Avoid stress. And also avoid wearing tight clothes. If you're on a medication such as aspirin for instance, you might need to avoid other medications that can interact with aspirin to cause indigestion such as ibuprofen. This is known to cause stomach ulcers. In terms of tests, if for example you wanted to know exactly what's causing your symptoms, or for example you've been on medication and it's not working, then you might need to see your doctor for further tests such as for example your doctor might want to do a stool test to look for any signs of a bacterial infection such as Helicobacter pylori, and this can be treated with antibiotics and omeprazole. Your doctor might also want to do an ultrasound looking for other causes that might mimic indigestion such as gallstones, or for any signs of liver disease which can be brought about by some of your lifestyle practices such as taking too much alcohol. Now having an endoscopy is usually taken again if medication is not working, if you're over the age of 55, or you might have some of the symptoms we mentioned that might indicate this is not simple indigestion such as difficulty swallowing, loss of appetite, weight loss, and all the other symptoms. This is simply a camera test, which is a long, thin, flexible tube that goes through the mouth, through your esophagus, stomach, and into the small bowel. And it's basically a visual inspection of the inside, and a small tissue biopsy is usually taken to look for any abnormal cells. You'd also have blood tests such as a full blood count, looking for any signs of anemia that might indicate you need further investigation, as well as a liver function test, which normally gives clues as to whether you drink too much alcohol or you might have gallstones. So if you're taking over-the-counter medication and you're not better after about 2 weeks of taking over-the-counter medication, then really you need to be seeing a doctor in case you need further investigations. So if you like this video, please subscribe to my channel, and you can check out my other videos on digestive health.